ovarian cysts are basically fluid-filled sacs that can develop on the ovaries. They can form as part of a normal menstrual cycle or due to some abnormal growth. So basically, two main types are there: functional cysts and pathological cysts. Functional cysts are the most common ones, and they form during the menstrual cycle, like the follicular cyst and the corpus luteum cysts. Now we have the pathological cysts, which are less common and usually due to result from an abnormal cell growth. So these can include a dermoid cyst, cystadenoma, endometrioma. So these are some pathological cysts. If we talk about dermoid cysts, these cysts basically contain tissue, hair, skin, even teeth sometimes, because they originate from embryonic cells and are usually benign, but they can become large and cause pain or some complications to the patient, and are usually treated by a surgery. Then we have endometriomas, which are also known as chocolate cysts, and these form from endometrial tissue, which basically lines the uterus lining. And they grow within the ovaries, and they're sometimes associated with endometriosis, and they cause pain and infertility. So endometriosis and endometriomas mostly coexist. And then we have cystadenomas. These cysts basically develop from cells on the outer surface of the ovary, and they can be filled with some water content or some mucus content. Sometimes they can become quite large, but are usually benign. And then we have a very common syndrome, which is the polycystic ovarian syndrome, in which there are multiple small cysts which form within the ovaries, and they are basically due to hormonal imbalance, and it is associated with irregular periods, some kind of infertility, and other metabolic issues. Especially when we talk about like functional cysts, which are the most common cysts, they're almost always benign, and the best part is they typically resolve on their own. However, there are some type of cysts which can be cancerous. There are certain types of ovarian tumors, and the risk increases with age, especially after menopause. Common symptoms can vary widely, and they may include some kind of pelvic pain, discomfort, especially during menstruation or even intercourse, feeling of bloating or swelling in the abdomen, feeling of fullness or pressure in the lower abdomen, irregular menstrual cycle sometimes, painful bowel movements, urinary symptoms, especially if the cyst is large and they're compressing on these structures which are adjacent. There are different risk factors, and they may include like hormonal imbalances. We can have hormonal fluctuations, especially when we talk about polycystic ovarian syndrome. It is all about hormonal fluctuation. So people have multiple cysts, although they're very small. Endometriosis is a condition where tissue similar to the lining of the uterus is growing outside the uterus. There are various theories pertaining to it, and endometriosis, the theories are different, and which may lead to formation of endometriomas and endometriosis. So it is again a hormonal condition. Now, age is also a risk factor because women of reproductive age are more likely to develop ovarian cysts because functional cysts are related to menstrual cycle. However, cysts do also occur after menopause, but over there, the risk of being cancerous cyst is more. Women who have had a previous history of ovarian cysts are also at a higher risk of developing new cysts in the future. Even pelvic infections. So pelvic infections do not actually lead to cysts, but they lead to tubo-ovarian masses. So the ovaries and fallopian tubes combined, they form a mass, which is generally known as tubo-ovarian mass. Fertility can be affected by various ways, especially if a woman is having ovarian cysts, and the type of ovarian cyst is also important. Functional ovarian cysts typically do not impact fertility. However, there are certain types of cysts such as endometriomas or cysts related to PCOD, which may interfere with normal ovulation or even ovarian function, potentially affecting fertility. Now, what happens in endometriosis or PCOS? There is decreased ovarian reserve. They compromise the ovarian reserve by reducing the number of healthy eggs available for fertilization. Even surgical treatments such as cystectomy, which is removal of a part of the ovary, typically the cyst, may also remove healthy ovarian tissue sometimes along with the cyst, further impacting ovarian function. Even pelvic adhesions like chronic inflammation or repeated cyst formation can lead to the development of pelvic adhesions, which is basically a scar tissue inside the abdomen. And it distorts the pelvic anatomy and impair fertility by causing blockage or dysfunction of the fallopian tubes. These are certain mechanisms by which fertility can be affected. Another is creating an inflammatory environment, especially in endometriosis. A different environment is created inside the pelvis, which also impairs fertilization or sometimes even implantation. The diagnosis is through a combination of medical history, physical examination, and imaging studies. So first talking about history. So history is very, very important. You have to evaluate the symptoms of the patient, her medical history, information about previous medical condition, surgeries, previous number of pregnancies, family history of ovarian cyst or ovarian cancer. These can provide us valuable insights. And symptoms evaluation, basically a detailed discussion, because sometimes the symptoms are very vague, just like mild pelvic pain, persistent pelvic pain, just bloating, changes in menstrual cycle, or other related symptoms. Then comes the physical examination. So physical examination is, we do a pelvic examination, which is the per vaginal examination, and the doctor basically feels the pelvic area to detect the presence, if at all it is there, the size, the characteristics of the cyst, or any abnormalities in the ovaries or any surrounding structures. And then after doing the history and the physical examination, we have the imaging studies available. Now, imaging, the most important is a transvaginal ultrasound. It is the most commonly used technique to visualize the ovaries and to detect the ovarian cysts. It involves basically inserting small ultrasound probe into the vagina, and it gives us detailed images of the ovaries and allows us to assess the size, the shape, and the composition, the characterization of the cyst. Sometimes we do also request an abdominal ultrasound, especially if a female is not sexually active, or because then the transvaginal ultrasound is not feasible, or sometimes even to complement the evaluation, an additional trans-abdominal ultrasound is requested for. Now, other imaging modalities which are much more advanced is an MRI and a CT. MRI is magnetic resonance imaging, and it is recommended in cases where ultrasound is inconclusive or to obtain more detailed information about the cyst characteristics, especially if it is a larger cyst or when there's a suspicion of malignancy, especially in a complex cystic mass. Now, CT scan is also there, which is computed tomography, but they're less commonly used for routine diagnosis of ovarian cysts. But they may be employed in specific situations where further evaluation of cystic lesions is necessary. And then there are certain blood tests, although they're not very specific, like CA-125. It may be done. It is elevated in certain types of ovarian cysts, especially which are potentially cancerous. But it is also elevated in certain type of non-cancerous conditions. So having an elevated CA-125 in a case of ovarian cyst does not always mean it is cancerous. So the doctor will provide you more insights. Then diagnostic laparoscopy. So it's an invasive procedure. We insert a laparoscope inside the patient's abdomen. So it is done only in certain cases where the diagnosis is still unclear despite doing so many imaging studies, and there's a strong suspicion of a complex or potentially cancerous cyst. Then the diagnostic laparoscopy may be performed, and it's a minimally invasive surgical procedure and involves inserting a thin flexible tube which has a camera attached to it, which we call as the laparoscope, through a small incision in the abdomen to directly visualize the ovaries and other pelvic structures. So this is the list by which you can say we can certainly diagnose the nature of an ovarian cyst, starting from medical history to the diagnostic laparoscopy. Treatment options basically depend on several factors. First and foremost, including the nature of the cyst, whether it is cancerous, whether it is non-cancerous, whether it is in between, which we call as borderline ovarian cyst, the size, the symptoms. So these are the characteristics. So one is watchful waiting, like small asymptomatic cysts may resolve on their own, especially as I told, functional cysts, and they can be monitored with regular ultrasound. And then we have medications like oral contraceptive pills, which are basically hormonal pills. They can prevent new cysts from forming. And then we have an option of surgery, especially if a cyst is large, it is persistent, it is causing significant symptoms, or is suspicious for cancer. Then we can go for a surgical removal of the cyst or the ovary, depending on the nature of the lesion, if it is benign or cancerous. If it is cancerous, then a full staging surgery is also performed. Some steps which a patient or a woman can take is regular pelvic examination. You should have a routine checkup with a gynecologist. At least an annual health checkup is recommended. Annual ultrasound is also recommended, especially if you have a higher history of ovarian cysts or at a higher risk of being ovarian cancer. Then periodic transvaginal ultrasound scans are also recommended. You should also pay attention to your symptoms. This is very, very important. The patient should be aware of any changes in your menstrual cycle, any pelvic discomfort, any pain, any bloating, or any other symptoms that could indicate ovarian cysts. So these symptoms are generally vague, and if you have persistent symptoms like pelvic pain, bloating, indigestion, then you should certainly contact your gynecologist. And this was about monitoring. Now preventing, see, we have hormonal birth control pills, patches, or even intrauterine devices which help regulate your menstrual cycle, and they prevent ovulation. So if there is no ovulation, the chances of cyst formation is reduced. You have to manage hormonal imbalances, like a condition like PCOS or any other hormonal fluctuations will increase the risk of ovarian cysts. A healthy lifestyle is very, very important, which includes, balanced diet rich in fruits, vegetables, whole grains, and limiting processed carbohydrates, limiting the amount of sugar, regular exercise, because they will help regulate hormonal levels and support the overall reproductive health of the patient. And the importance of routine gynecological checkups. Regular screenings and examination can help detect ovarian cysts early. They can facilitate timely intervention if needed. So it is very, very important to have an annual health check with your doctor.